Welcome to Roadmap to Residency. Hello everyone, I am Abhiraz, and in this video we will be discussing about some important uterine conditions. 38-year-old woman presents with severe dysmenorrhea, prolonged and heavy menstrual bleeding, and pelvic pain. Physical examination reveals a tender enlarged uterus and palpation. Transvaginal ultrasound shows thickening of the myometrium with ill-defined hypoechoic areas. What is the most likely diagnosis? Ovarian cyst, endometriosis, leiomyoma, adenomyosis, or pelvic inflammatory disease? So, adenomyosis is a condition in which endometrial tissue, which normally lines the uterus, grows into the muscular wall of the uterus, and it can lead to symptoms such as severe dysmenorrhea, prolonged and heavy menstrual bleeding, and pelvic pain. On physical examination, the uterus may feel tender and enlarged. Transvaginal ultrasound often shows the thickening of the endometrium with ill-defined hypoechoic areas, indicating the presence of ectopic endometrial tissue within the muscular wall of the uterus. So there is the diffuse enlargement of the uterus in case of adenomyosis, but in case of leiomyoma, there is a focal enlargement of the uterus. Adenomyosis, where there is presence of endometrial tissue in the myometrium, may be due to the invagination of the basal layer of endometrium, presents with abnormal uterine bleeding and dysmenorrhea, and there is diffusely enlarged boggy uterus on examination. Endometriosis, we have discussed in the previous videos. Endometrial hyperplasia is when there is abnormal endometrial gland proliferation, usually caused by excess estrogen unopposed by progesterone, associated with obesity, PCOS, and hormone replacement therapy. Endometritis is when there is inflammation of endometrium, usually occurs after delivery due to the inoculation of uterine cavity by vaginal microbiota. Intrauterine adhesions is the fibrous bands of tissue within the endometrial cavity due to some infections or previous infections, and it is also called as the Asserman syndrome when it is symptomatic. 42-year-old woman presents with complaints of heavy menstrual bleeding and pelvic pressure. She has a history of irregular menstrual cycle. Pelvic examination reveals an enlarged, irregularly shaped uterus. Transvaginal ultrasound shows multiple well-defined hypoechoic masses within the uterine wall. What is the most likely diagnosis? Differentiate this from adenomyosis versus endometriosis or versus fibroid. So fibroid is the clinical presentation of heavy menstrual bleeding, pelvic pressure, and an enlarged irregular shaped uterus with well-defined hypoechoic mass. On transvaginal ultrasound is indicative of leiomyomas, also known as uterine fibroids. Leiomyomas are benign tumors of the uterine with muscle and connective tissue, and they often present with symptoms such as amenorrhea, pelvic pressure or pain, and an enlarged uterus. So this is the fibroid histology showing you, this is the muscle layer, and you can see this is the pseudo capsule that is surrounding this, and you can see a typical musculature like structure all around. Leiomyoma is benign tumor of myometrium. Most common gynecological tumor arises in the reproductive age females, and we have discussed about leiomyoma in other videos too, so I will not go in detail about that. But talking about endometrial carcinoma, which is a malignant tumor of endometrium and is important, is the most common gynecological cancer in resource-rich countries, usually arises in the postmenopausal woman and presents with abnormal uterine bleeding. Endometrial carcinoma is the most common subtype of endometrial carcinoma, and it is associated with long-term exposure to unopposed estrogen. Histology will show a confluent endometrial glands without intervening stroma. So now this is the histology of endometrial carcinoma. Here you can see the keratinizing squamous cell carcinoma in the right, which merges with the adenocarcinoma, which is here in the left. What is the most likely diagnosis? 65-year-old postmenopausal woman presents with vaginal bleeding. She reports unintentional weight loss and fatigue over the past few months. Pelvic examination reveals an enlarged uterus. Endometrial biopsy is performed, and histopathological examination shows atypical glandular cells with irregular nuclei invading the stroma. Even histochemistry is positive for estrogen and progesterone receptors. Most likely diagnosis is what? So endometrial carcinoma, the clinical presentation of postmenopausal vaginal bleeding, unintentional weight loss, and fatigue raises the concern for endometrial carcinoma. Histopathology is also typical, and the positive staining for estrogen and progesterone receptor is common in endometrial carcinoma, highlighting the hormone receptor status. Thank you for watching. Keep studying hard.